So how would I treat this amazing C-section scar? Well, I'd start with lovely, lovely Featherlite Sweeping. And if you're watching this video yourself, I would recommend you always starting with that lovely Featherlite Sweeping. You can see that sometimes it makes the skin bubble because it can be quite ticklish, but it's a lovely way to engage with that scar first of all. And it's light touch. This isn't something that is hard, that you're getting in and getting the job done. It's that light touch therapy over the skin, over the body, and gently touching the scar. What you're doing is sending signals back to the brain to say, this is my tummy, this is my scar, and it's okay to touch both of them. With a C-section, it's a big surgery, cutting through 7 layers of your skin, fat, tissues, separating the rectus sheath, and of course through your uterus as well. It's really important that we look after this area of our bodies after a C-section, which can sometimes be forgotten. So how do I treat this C-section scar? So this one, we've said that it's a hypertrophic, nice and flat hair. Well, I will start on this side, so on the right side, and I'd probably try and see how the scar is pulling through the fascial connections, which with this scar, it's had work on it and it's feeling really good. So I'd add some tension on this side, and then I would bring my thumb in here and I would slide it across. And you might be able to notice already how the colour comes out of the scar. And then I bring my finger behind and pull across. Bring my finger behind, pull across. Bring my finger behind, pull across. And so on until the end of the scar. We call this the slide and glide technique because you're sliding and gliding across the scar. And I would go forwards and backwards like this. And you can do this on yourself. And I'd also recommend having some oil on your hands, and I've put Naki Skin Optimizing Oil on my fingers so we can start to hydrate the scar and the tissue as we're working over that scar. It's also nice to massage your tummy with a really good hydrating oil or cream. And what we want is something that's going to go through your dermis, your epidermis and your hypodermis of your skin, right through to those deep layers of the hypodermis of your skin to really nourish that scar. So we've got the slide and glide technique. How long would we do it for? About 5 minutes or so every single day. You can see that I'm not pushing deep into the scar either, taking my time, light touch first of all the way across and then all the way back again. And you can see the colour comes out of that scar. What would I do next to treat this scar? Well, I would encourage the client to do light circular motions over the scar, going round and round and round. And what are you doing here? You're mobilising that scar. You're helping with those connections deep underneath that scar as well. And of course, you're engaging and touching that scar. This always happens 6 weeks plus, as long as the scar is healed over, no infection, and you yourself are happy to treat your scar. So I'd do that nice slide and glide, and I would do those circles. I might even get my client to put 2 hands over the scar and do some lovely deep breathing, which we're going to demonstrate now. So if you pop both hands over your scar, one and then the other, and then what I'm going to ask you to do is breathing in through your nose and allow the air to fill your belly, and then out through your mouth, and then allow the belly just to relax. So we'll count to 3. 1, 2, 3. Nice big deep breath in through your nose. Lovely slight hold and out through your mouth. Lovely, and relax and turn to your normal breathing. We would do that a couple of times just to relax your body. Your nose warms, filters and moistens the air, so you get a better quality of air when you nose breathe, and your body physiologically relaxes. So if you're in a very stressful situation, or you are anxious about touching your scar for the first time, I'd encourage you to relax, lay down, have those nice few deep breaths in with your hands over your scar, and take a few breaths in and just allow your body to relax. Your recovery is no rush and it will take time, so start your scar massage when you feel ready. So I've shown that slide and glide, I've shown those nice circles. With this scar, because it has been treated before, I would actually use a rolling effect over the scar, and slightly more difficult to demonstrate, so I would be on the other side here, but I would get both my fingers in, down into the scar, and lift up, roll down, lift up and roll down. And then I'll do the same, moving across like this, and then like this. Your fingers are across the scar, always in contact with the scar, and you can go forward and backwards as you're moving in and out, a bit like the waves of the sea, rolling forward and back. You can see that I'm going a little bit deeper, but not deep so that it's causing pain, and also you don't want to make those scars red. So you don't want to aggravate those tissues. If you're doing your scar massage and the tissues become inflamed and red, then please stop. Give yourself 1 or 2 days just of rest, no massage, allow the tissues to heal, and then start again at a lighter pace.